Providing bloodless care to patients is simply providing medical care without giving patients blood donated by another person. The way we do this is to conserve blood by reducing or eliminating bleeding, by stimulating the body to make its own blood cells at an accelerated rate, and also by recycling blood that patients lose during surgery and giving them back their own blood. Well, there are several reasons why patients may choose a bloodless approach to their surgery. Historically, patients have elected to avoid transfusion because of religious reasons, but also some patients just simply wish to avoid the risk or the side effects of transfusion. For example, we know that patients treated with the bloodless methods have a shorter length of stay, decreased incidence of hospital-acquired infections, and also less chance of an allergic reaction or even receiving the wrong unit of blood, which still occurs. The first thing we do is we diagnose or treat anemia prior to surgery, so patients come to the operating room with enough red blood cells so they can tolerate any blood loss. During surgery, we can avoid hypothermia or hypertension, both of which can increase bleeding. And then we can collect and recycle the blood they lose using the cell saver and give them back their own blood during surgery. We can also use what we call ANH, acute normal volemic hemodilution, which is where we bank the patient's own blood at the beginning of the case and give it back to them at the end of the case. There's one more technique. There's new versions of electrocautery that have come out recently that can dramatically decrease bleeding during orthopedic cases and during spine surgery, for example. Virtually 99% of all the procedures we do can be performed without transfusion. For example, we've done some really big surgeries like a Whipple for pancreatic cancer. We've done many of those without transfusions. We've done open heart surgeries, even revision open heart surgeries for valve replacements and bypass surgery without blood. And recently, we even did a 6-kilogram baby, that's about a 14-pound baby, who had open heart surgery for tetralogy of Fallot, requiring cardiopulmonary bypass without a transfusion. We believe that we offer more different types of specialty care than any other hospital in the country that has a bloodless program. Plus, our program blends seamlessly into the care plan that's offered by all varieties of specialties within the hospital. Surgery itself is becoming less and less invasive. For example, the laparoscopic and robotic approach to different surgeries have dramatically decreased the amount of blood that patients lose and the amount of transfusions they require. Also, we're giving new intravenous medications like iron, or we're even giving erythropoietin, which is one of the medications that the professional cyclists use to blood dope, only now we're giving it legally to our patients to build their blood counts prior to surgery so they don't require a transfusion.